Welcome to today's NCLEX Case Study Masterclass, the one video that could determine whether you pass or fail the NCLEX. In the next few minutes, you'll face real-life critical scenarios exactly the way the exam presents them: complex patients, shifting priorities, labs that change everything, and decisions where one wrong move can cost a life. Most students give up halfway, but the ones who stay till the end understand the patterns, master the strategies, and walk into the exam with unshakable confidence. So if you're serious about passing the NCLEX on your next attempt, don't just watch, study this video. Take a deep breath. Focus. Let's dive into your NCLEX success story. Question 1. A patient taking warfarin has an INR of 6.2. What should the nurse do first? A. Encourage green leafy vegetables. B. Administer vitamin K. C. Hold the next dose only. D. Recheck INR in 1 week. Correct answer, B. Administer vitamin K. Rationale: an INR above 6 places the patient at a very high risk for bleeding. Vitamin K is the reversal agent and must be given immediately. Strategy: when a medication reaches a toxic or dangerous level, always choose the intervention that provides the fastest reversal. Question 2. A postoperative client receiving 4 morphine has a respiratory rate of 6 breaths per minute. What is the priority action? A. Apply oxygen via nasal cannula. B. Administer naloxone. C. Notify the provider. D. Decrease the next morphine dose. Correct answer, B. Administer naloxone. Rationale: naloxone immediately reverses opioid-induced respiratory depression. Strategy: when a drug causes life-threatening depression of vital signs, give the antidote first. Question 3. A patient taking lisinopril develops a persistent, dry cough. What should the nurse do? A. Encourage warm water intake. B. Notify the provider to switch to an ARB. C. Reassure the patient it is harmless. D. Administer a cough suppressant. Correct answer, B. Notify the provider to switch to an ARB. Rationale: ACE inhibitors cause chronic cough and should be changed to an ARB. Strategy: when a medication causes a common but persistent adverse effect, choose the option requiring a medication change. Question 4. A patient taking digoxin has a serum level of 2.8 nanograms per milliliter. What is the priority action? A. Continue the medication. B. Administer digoxin immune fab. C. Increase potassium-rich foods. D. Hold the next dose and monitor. Correct answer, B. Administer digoxin immune fab. Rationale: a level above 2.0 indicates toxicity, antidote is required. Strategy: in drug toxicity, give the reversal agent before any other intervention. Question 5. A patient on furosemide reports muscle weakness and fatigue. Labs show potassium of 2.9 milliequivalent/L. What should the nurse do first? A. Encourage fruit intake. B. Administer potassium supplement. C. Hold the furosemide. D. Recheck potassium in 6 hours. Correct answer, B. Administer potassium supplement. Rationale: hypokalemia from loop diuretics requires immediate replacement. Strategy: when electrolyte imbalance is symptomatic, choose the option that corrects the imbalance fastest. Question 6. A client on gentamicin reports ringing in the ears. Which action is most appropriate? A. Reassure the patient it will resolve. B. Notify the provider immediately. C. Give acetaminophen. D. Increase fluid intake. Correct answer, B. Notify the provider immediately. Rationale: gentamicin can cause ototoxicity, which may be irreversible. Strategy: when a drug causes a potentially permanent adverse effect, stop the drug and notify the provider. Question 7. A patient taking metoprolol has a heart rate of 48 bpm. What should the nurse do first? A. Administer the medication. B. Hold the medication and notify the provider. C. Give atropine. D. Reassess in 30 minutes. Correct answer, B. Hold the medication and notify the provider. Rationale: beta blockers should be held if HR less than 50 bpm. Strategy: always check vital signs before cardiac medications, hold if vitals are unsafe. Question 8. A diabetic patient taking insulin becomes sweaty, confused, and shaky. What action is priority? A. Call the provider. B. Give 15 g of fast-acting carbohydrate. C. Recheck blood sugar in 1 hour. D. Offer a high-protein snack. Correct answer: B. Give 15 g of fast-acting carbohydrate. Rationale: these symptoms indicate hypoglycemia, rapid glucose is required. Strategy: hypoglycemia is the most dangerous complication of insulin, treat immediately. Question 9. A patient starting nitroglycerin reports a severe headache. What should the nurse do? A. Stop the medication. B. Give acetaminophen. C. Reassure that this is an expected side effect. D. Lower the dose. Correct answer: C. Reassure that this is an expected side effect. Rationale: headache is common due to vasodilation. Strategy: when a side effect is expected, choose reassurance unless it threatens safety. Question 10. A client on heparin has a PTT of 120 seconds. What should the nurse do first? A. Continue infusion. B. Stop heparin infusion. C. Give aspirin. D. Recheck PTT in the morning. Correct answer: B. Stop heparin infusion. Rationale: a PTT above 100 increases bleeding risk, infusion must be stopped. Strategy: when lab values indicate excessive anticoagulation, hold the medication. Question 11. A patient taking spironolactone has a potassium level of 5.9 milliequivalent/L. What is the nurse's priority action? A. Continue the medication. B. Hold the medication. C. Increase potassium-rich foods. D. Give potassium supplement. Correct answer: B. Hold the medication. Rationale: spironolactone is potassium-sparing, hyperkalemia can occur and is dangerous. Strategy: when a medication worsens a lab value, hold it immediately. Question 12. A client on vancomycin reports flushing, itching, and a drop in blood pressure during infusion. What should the nurse do first? A. Stop the infusion. B. Slow the infusion rate. C. Administer diphenhydramine. D. Document the reaction. Correct answer: A. Stop the infusion. Rationale: these are signs of red man syndrome, stopping infusion prevents worsening. Strategy: when a patient has an infusion reaction, stop the infusion first. Question 13. A client taking metformin is scheduled for a CT scan with contrast. What must the nurse do first? A. Give the metformin. B. Hold metformin before the procedure. C. Offer a snack. D. Increase fluid intake. Correct answer: B. Hold metformin before the procedure. Rationale: metformin plus contrast can cause lactic acidosis and kidney injury. Strategy: hold drugs that interact with contrast dye. Question 14. A patient receiving 4 potassium reports burning at the 4 site. What should the nurse do? A. Slow the infusion rate. B. Stop the infusion. C. Apply warm compress. D. Push the medication faster. Correct answer: A. Slow the infusion rate. Rationale: potassium often causes irritation, slowing the rate usually resolves it. Strategy: when a medication causes expected discomfort, adjust the rate first. Question 15. A patient taking phenytoin has a level of 25 micrograms per milliliter. What should the nurse do? A. Continue the dose. B. Hold the dose and notify the provider. C. Give the next dose early. D. Encourage more fluids. Correct answer: B. Hold the dose and notify the provider. Rationale: therapeutic range is 10 to 20, level 25 indicates toxicity. Strategy: hold drugs with toxic level and notify provider. Question 16. A client prescribed prednisone reports black tarry stools. What is the priority action? A. Reassure the patient. B. Encourage hydration. C. Notify the provider immediately. D. Hold the next dose. Correct answer, C. Notify the provider immediately. Rationale: steroids increase GI bleeding risk, melena is a medical emergency. Strategy: GI bleeding signs always require immediate reporting. Question 17. A patient on clozapine reports a sore throat and fever. What should the nurse do? A. Give acetaminophen. B. Hold dose and notify provider. C. Offer warm fluids. D. Continue medication. Correct answer, B. Hold dose and notify provider. Rationale: clozapine can cause agranulocytosis, sore throat plus fever equals infection risk. Strategy: for drugs causing bone marrow suppression, stop medication for infection signs. Question 18. A client taking sertraline reports new suicidal thoughts. What is the priority action? A. Document findings. B. Notify provider immediately. C. Encourage relaxation techniques. D. Reassess in 1 hour. Correct answer, B. Notify provider immediately. Rationale: SSRIs can increase suicidal ideation, especially early in therapy. Strategy: any change in mental status requiring safety notify immediately. Question 19. A client taking isoniazid for TB reports yellowing of the skin. What should the nurse do? A. Continue medication. B. Notify provider. C. Offer antihistamine. D. Encourage hydration. Correct answer, B. Notify provider. Rationale: jaundice suggests hepatotoxicity. Strategy: liver toxicity always requires stopping the drug. Question 20. A patient prescribed epinephrine autoinjector asks when to use it. A. With mild itching. B. With wheezing, swelling, or severe allergic reaction. C. With nausea only. D. With mild rash. Correct answer, B. With wheezing, swelling, or severe allergic reaction. Rationale: epinephrine treats anaphylaxis. Strategy: prioritize life-threatening symptoms. Question 21. A patient taking calcium channel blockers has ankle edema. What should the nurse do? A. Notify the provider. B. Stop the medication. C. Reassure the patient. D. Restrict fluids. Correct answer, A. Notify the provider. Rationale: edema is a common side effect but requires dose evaluation. Strategy: for non-life-threatening adverse effects, notify provider for medication adjustment. Question 22. A patient receiving 4-magnesium sulfate develops absent deep tendon reflexes. What is the priority? A. Continue the infusion. B. Stop the infusion. C. Increase the rate. D. Recheck in 30 minutes. Correct answer, B. Stop the infusion. Rationale: loss of reflexes indicates magnesium toxicity. Strategy: when a drug causes dangerous CNS depression, stop it. Question 23. A client taking lithium has a level of 2.0 milliequivalent/L. What should the nurse do? A. Continue dose. B. Hold dose and notify provider. C. Give more fluids. D. Encourage salt restriction. Correct answer, B. Hold dose and notify provider. Rationale: therapeutic level is 0.6 to 1.2. Level 2 indicates toxicity. Strategy: toxic levels equals hold and report. Question 24. A client taking amiodarone develops bluish skin discoloration. What should the nurse do? A. Reassure the patient. B. Hold the dose. C. Give diphenhydramine. D. Notify the provider. Correct answer, D. Notify the provider. Rationale: indicates long-term toxicity requiring dose evaluation. Strategy: chronic adverse effects notify, do not stop abruptly. Question 25. A patient taking statins reports severe muscle pain. What is the priority? A. Encourage exercise. B. Notify provider immediately. C. Reassure the patient. D. Increase fluids. Correct answer, B. Notify provider immediately. Rationale, myopathy can lead to rhabdomyolysis. Strategy, report adverse effects that can affect kidney function. Question 26. A patient receiving insulin becomes sweaty and confused. What should the nurse do first? A. Offer a high-protein meal. B. Give 15 g fast-acting carbohydrate. C. Notify the provider. D. Give glucagon IM. Correct answer, B. Give 15 g fast-acting carbohydrate. Rationale, signs of hypoglycemia, rapid glucose correction. Strategy, treat low blood sugar quickly before it worsens. Question 27. A patient on epoetin alpha has a hemoglobin of 13.5 g/dl. What is the nurse's action? A. Continue the dose. B. Hold the dose. C. Increase the dose. D. Recheck in 1 week. Correct answer, B. Hold the dose. Rationale, target hemoglobin is less than 11, higher levels increase clotting risk. Strategy, hold medications that make blood too thick. Question 28. A patient taking aspirin reports tinnitus. What should the nurse do? A. Continue the medication. B. Hold and notify provider. C. Encourage hydration. D. Offer food with medication. Correct answer, B. Hold and notify provider. Rationale, tinnitus is early sign of salicylate toxicity. Strategy, recognize early toxicity signs and intervene. Question 29. A client on levothyroxine reports chest pain. What is the priority action? A. Give the medication. B. Hold the medication. C. Encourage fluids. D. Offer reassurance. Correct answer, B. Hold the medication. Rationale, chest pain equals possible overmedication causing cardiac strain. Strategy, hold medications that increase metabolic demand when symptoms appear. Question 30. A patient starting albuterol reports tremors. What should the nurse do? A. Reassure the patient. B. Stop the medication. C. Notify provider. D. Give beta blocker. Correct answer, A. Reassure the patient. Rationale, tremors are expected with beta agonists. Strategy, expected side effects equals reassurance. Question 31. A patient taking MAOIs asks which food to avoid. A. Fresh fruits. B. Aged cheese. C. Rice. D. Eggs. Correct answer, B. Aged cheese. Rationale, tyramine causes hypertensive crisis. Strategy, no major food-drug interactions. Question 32. A patient receiving mannitol shows crackles in the lungs. What is the priority? A. Continue the medication. B. Stop the infusion. C. Reassure the patient. D. Increase fluids. Correct answer, B. Stop the infusion. Rationale, crackles equals fluid overload. Strategy, stop medications that worsen fluid retention. Question 33. A client taking propranolol has a history of asthma. What is priority? A. Continue therapy. B. Notify provider immediately. C. Give bronchodilator. D. Encourage deep breathing. Correct answer, B. Notify provider immediately. Rationale, non-selective beta blockers can cause bronchoconstriction. Strategy, identify contraindicated medications. Question 34. A patient taking carbamazepine develops a rash. What should the nurse do? A. Document it. B. Notify provider immediately. C. Reassure the patient. D. Give diphenhydramine. Correct answer, B. Notify provider immediately. Rationale, rash may indicate Stevens-Johnson syndrome. Strategy, severe skin reactions emergency. Question 35. A patient taking tamsulosin reports dizziness when standing. What should the nurse do? A. Encourage fluids. B. Teach slow position changes. C. Stop medication. D. Increase the dose. Correct answer, B. Teach slow position changes. Rationale, orthostatic hypotension is common. Strategy, teach safety measures for expected effects. Question 36. A patient on methotrexate reports mouth sores. What should the nurse do? A. Reassure the patient. B. Notify provider. C. Provide oral care. D. Increase fluids. Correct answer, B. Notify provider. Rationale, indicates bone marrow suppression. Strategy, report signs of immunosuppression. Question 37. A patient taking opioids becomes difficult to arouse. What is the priority? A. Call provider. B. Give naloxone. C. Increase 4 fluids. D. Provide stimulation. Correct answer, B. Give naloxone. Rationale, decreased LOC equals respiratory depression. Strategy, always give antidote first. Question 38. A patient taking potassium chloride tablets reports difficulty swallowing. What should the nurse do? A. Reassure the patient. B. Crush the tablet. C. Request a liquid form. D. Give more water. Correct answer, C. Request a liquid form. Rationale, extended release K plus tablets must not be crushed. Strategy, know which medications cannot be crushed. Question 39. A patient on clopidogrel is scheduled for surgery tomorrow. What should the nurse do? A. Continue the medication. B. Notify provider. C. Give aspirin. D. Hold dose for 24 hours. Correct answer, B. Notify provider. Rationale, clopidogrel increases bleeding risk, provider must stop it. Strategy, antiplatelets must be held before surgery. Question 40. A client on haloperidol develops neck spasms. What should the nurse do first? A. Give benztropine. B. Hold dose. C. Notify provider. D. Document. Correct answer, A. Give benztropine. Rationale, dystonia treat immediately with anticholinergic. Strategy, recognize extrapyramidal symptoms and treat fast. Question 41. A client is prescribed nitroprusside and suddenly becomes hypotensive. What is priority? A. Continue the infusion. B. Decrease the rate. C. Stop the infusion. D. Recheck BP in 10 minutes. Correct answer, C. Stop the infusion. Rationale, nitroprusside can cause dangerous hypotension. Strategy, stop medications causing sudden severe blood pressure changes. Question 42. A client taking rifampin notices red-orange urine. What should the nurse do? A. Stop the medication. B. Reassure the patient. C. Notify provider. D. Give 4 fluids. Correct answer, B. Reassure the patient. Rationale, this is a harmless expected effect. Strategy, normalize benign side effects. Question 43. A patient receiving 4 antibiotics develops diarrhea. What should the nurse do first? A. Continue therapy. B. Assess for C. difficile. C. Hold dose. D. Give antidiarrheal. Correct answer, B. Assess for C. difficile. Rationale, antibiotics frequently cause C. diff infection. Strategy, always assess first when new symptoms arise. Question 44. A patient taking sildenafil asks when to avoid using it. A. When hungry. B. When taking nitrates. C. When stressed. D. When tired. Correct answer, B. When taking nitrates. Rationale, combination causes fatal hypotension. Strategy, no life-threatening drug interactions. Question 45. A client on lactulose for hepatic encephalopathy reports 3 loose stools. What should the nurse do? A. Stop the medication. B. Continue medication. C. Notify provider. D. Give antidiarrheal. Correct answer, B. Continue medication. Rationale: loose stools indicate medication effectiveness in removing ammonia. Strategy: evaluate expected therapeutic outcomes. Question 46. A client taking ferrous sulfate reports dark stools. What is the priority? A. Stop medication. B. Reassure that this is normal. C. Notify provider. D. Decrease dose. Correct answer: B. Reassure that this is normal. Rationale: iron commonly causes dark stools. Strategy: identify harmless expected effects. Question 47. A patient on prednisone for long-term therapy asks about stopping the drug. A. Stop immediately. B. Taper the dose slowly. C. Skip one dose weekly. D. Reduce by half immediately. Correct answer: B. Taper the dose slowly. Rationale: sudden withdrawal may cause adrenal crisis. Strategy: steroids must always be tapered. Question 48. A patient taking bisoprolol has wheezing. What should the nurse do? A. Give scheduled dose. B. Hold medication. C. Encourage coughing. D. Reassess in 1 hour. Correct answer: B. Hold medication. Rationale: beta blockers can worsen bronchospasm. Strategy: hold drugs contraindicated in respiratory issues. Question 49. A patient taking valproic acid reports abdominal pain and vomiting. What should the nurse do? A. Continue medication. B. Notify provider. C. Give with food. D. Encourage fluids. Correct answer: B. Notify provider. Rationale: may indicate pancreatitis. Strategy: recognize severe abdominal symptoms as emergencies. Question 50. A client on codeine reports constipation. What should the nurse recommend? A. Stop medication. B. Increase fluids and fiber. C. Reduce dose. D. Add antihistamine. Correct answer: B. Increase fluids and fiber. Rationale: constipation is a common opioid side effect. Strategy: provide non-pharmacologic interventions for mild, expected effects. If you stayed till the end of this video, you've already done more than 90% of nursing candidates. These case studies are designed to stretch your clinical judgment, sharpen your prioritization skills, and prepare you for the toughest NCLEX challenges. Now I want to hear from you. Comment your score below, and tell me which question challenged you the most. Your feedback guides the next set of advanced NCLEX videos. Don't forget to like, share, and subscribe. Your dream of becoming a licensed nurse is closer than you think. See you in the next NCLEX Masterclass.